Uh, Good afternoon, everyone. Myself, Dr. Rajeev Nangia, Senior Consultant, Ear, Nose, and Throat Department at Apollo Spectra, Karol Bagh. And welcome back for another session of informative things about rhinoplasty today, about the nose. The topic today we are talking is rhinoplasty. Actually, it's a very huge topic and try to concise it out. And I made a few objectives of that. First, we'll talk about something about the history of the rhinoplasty. Then I'll give you an idea of what's the anatomy of the nose. Then we'll talk actually how do you define rhinoplasty. Then what are the indications, and then what are the techniques of the rhinoplasty. Then followed by a brief idea of the steps and the duration of the rhinoplasty, and then the complication and the risk factors. So first of all, we'll start like rhinoplasty. Rhinoplasty is made of two words. One is a rhino, and another is a plasm. Rhino means nose, and plasm means the reshaping or reshaping of the nose. So that's why it is known as surgery, in which we do the reshaping of the nose, whether it's for functional purposes or the cosmetic purposes. So basically, we can define this like a surgical method to improve either the shape of the nose due to some trauma or anything like, or even improving the shape along with the function of the nose. Now we talk about the brief history. This first started in 1887, and the first procedure was done by John Orlando Rowe, and then the first cosmetic procedure was done in 1898, sorry, by Jack Joseph. Then the many cases have been reported during the First World War. When they were having a lot of injuries to the nose and everything, then many cases people have tried rhinoplasties over there. In India, this is basically done by Shushista about 2000 years ago, and he's done many other procedures like improving the hum, improving the shape, and other things. Now I'll talk about a brief thing about the anatomy. I think if you can see this first thing is the nasal bones. There are two nasal bones with the fused in the middle line. Then there are over here there's the upper lateral cartilage, and the dome which is formed by the nose. This is the lower lateral cartilage, and they fuse in between. This form the columella. So we correct all this tissue along with the fatty alveolar tissue and other small parts. We reshape the whole thing. So this was a brief anatomy. Actually, anatomy is very complex, so I cannot just explain in one session like that. And now we talk again like what is rhinoplasty. Like I already told you, this is a surgery of the nose to improve the function, and we can make the nose wider, narrower, longer, shorter. There's sometimes there's a tilt like this. The tilt in the nose is there. This is a tip which is going down, or tip which is going up. Sometimes these nasal passages, they are small or narrow depending on this thing. And mostly in women it is done for the cosmetic procedures, and you can see in the models and the other top personalities nowadays, many young girls today are getting cosmetic surgeries done according to the nose shape. Now there are two types of things, like one is aesthetic, like I already told you, mainly it is cosmetic. Again, we can we can change the size, shape, the length, the width, everything of the nose. Then there's the tilt of the nose that can be taken care of. And then due to some traumas or like accidents or something, there's a change or there's a crookedness of the nose. You must have seen many people who have a nose deviated towards a good example is like Akhilesh Yadav also. You can see his nose. He's got a heavy tilt and all the things. So, and certain cases there were hump, like over here on the nose, there's a hump like a camel's back hump, or sometimes there's a trauma to it and the nose gets depressed due to some diseases or something, some abscesses, all the things. So all these shape things are there, and whenever the patient comes to us first, we have to give him a good counseling for about 40-45 minutes, make him sit down with his relative and everything. We have to take the photo from all the angles, from the right angle, from the left angle, from the front angle, from the top angle, from a 45-degree angle, so that normally a person has not seen his nose in his mirror thoroughly. So once he comes to us, then he starts seeing his nose. These are the problems. That is the thing. So we have to first make him show that these are the things which are there in his nose previously also, and after all, what all we can correct, what all we can't correct. We have to explain everything. Everything should be transparent. Everything should be clear, because the maximum the medical sue, the insurance claims and all the things, the suing or the doctors is done abroad, and mostly abroad in India also nowadays, in the cases of cosmetic rhinoplastic things and all the things. So we have to tell the patient everything, have to be crystal clear. See what is his skin type, what is his body healing type, how much scarring we can expect. So he should know everything, and tell him like we can give you about this much of results and this much of results cannot be given. So there are no guarantees in medical field. So everything has to be crystal clear. Right. And then what we can sometimes scarring also can be taken care of with this. Then we come to the functional rhinoplasty. What is a functional rhinoplasty? In this, normally, like I told you, all these structures, and then there's a central uh, partition, which we call as a septum, between the two nasal cavities, which is initially in the front, it's made of a quadrilangular cartilage, followed by a bone that again is a perpendicular plate, and the lower bone is a vomer. So we might have to correct all these deviation, whether it's an anterior deviation or posterior deviation, or whether any spur is there or any duplication of the septum is there. So that is again decided and taken care on the table itself. So that is to improve the breathing problem. The benefit of this is we improve the shape of the nose along with the breathing problem, that is functional things. Now coming to the techniques, there are basically two techniques. One is the closed technique. Closed technique means hardly there's a, everything is done from inside the nose to the intra-alar incision, and this is basically for minor changes or minor problems. Now we normally prefer to do an open rhinoplasty. What we do in that is we give a small inverted V uh, cut over here, and then we lift the whole skin. Once we lift the whole skin, everything like I showed you, all the cartilages, all the septum, all the bones, everything is in the view. The formation of the tip, the formation of the column, everything in the view, and major reshaping, whatever we have to do, and mostly we prefer open rhinoplasty because that gives a better result and other things. But for minor things, we can just do small close incisions. Like now I said, close is basically, I told you, I just talked something about the cold close and the open rhinoplasty. Close is very small incision, like I told you, from the nose itself, and sometimes from here, the osteotomy lines, we do it over there. So there hardly any scarring. So that is the main thing about that. And we need specialized instrumentations for the rhinoplasty. There's a particular set of it, and all those things to be very fine because we are dealing with skin, so we don't want to damage the skin and we can cause scarring of that. And we can correct the septum, like I already told you, which is the septorhinoplasty we call. Right. Then the crooked nose, again the nose shape and everything can be done. And incision is basically, I told you, in the alar region. And open, I already have told you, like we make an inverted V. We can lift up the skin. We see all these structures, and the benefit is like we can do all type of things. We can shorten the tip. We can tilt the change things, and everything we have, because of, there's a big field is there, and we can easily do the things. We can correct the hump. We can put a nasal, like if there's a depression in the nose, we have to put some cartilage or some fillers, then we can put that. Or if there's a hump, then we can remove it, and we can just saw it out, or even we can just chisel it out, depending on the thing which is needed for the particular patient. Now, main disadvantage of the open rhinoplasty is that there is a, you can't see a small scar over here, but that is hardly anything. That's and the advantage, I told you, you can work for all these tissues, all these tissues exposed, and we can work very fine, in a very fine manner. Now you will ask the approximate duration of a rhinoplasty. Approximate duration can vary anywhere from 1.5 to 3.5 hours, especially under GA. Now we will talk about the basic steps, what we do in rhinoplasty. First, we have to give general anesthesia, preferably with general anesthesia because the patient is sleeping, and we can do all the things easily and maneuver everything. Then, like the incision for the close, I told you it's right from inside the nose, the inter-LS incision, and the outside, the osteotomy incision. But for the open, I have told you that's an inverted V. So that we have to do and lift up the skin and do other things. Then we have to, depending on the defect, we have to take care of the minor things or the major things, whatever the particular need of the patient or particular thing what the patient has, and whatever we see. Sometimes the septum correction is needed. We correct the septum also, so that we give the functional improvement also. And then we go with the closure. Closure is done with Prolene about 5-0, so that very small stitches or many stitches come, but there are most of them are observable ones, but some stitches we have to remove, the skin stitches and all the things, and the recovery takes about few weeks. So now we'll talk about the main complications with the correction what we do basically in the rhinoplasty. First of all, like I told you, the humps or a depression of the nose. Then is the deviation. You might have seen the nose something like this or this. Because of deviation of the septum. Then the crooked deformity, which includes the nasal bone and everything. And sometimes people have a very bulbous tip nose. Like then we have to reduce that nose. Somebody has a very small nose, and we have to increase, augment that. Then the tip deformity, which is going down, which is going up. Then the passages, the nose passages, some people are very narrow, some people are very wide. Then accordingly, and according to the patient need, we do that. Now coming to the last part of it, we'll talk about the complications, which are very rare. And first is infection. Like in any surgery, there can be infection. So we normally take care of it with the antibiotics and other things, which is normally a very rare thing. And the second comes the post-operative bleeding. Now, again, this is very rare, but what happens, not many people know that when we breathe, the nose is producing about 4 to 5 liters of water, which get dried up with the air. And even your tears, they go into the nose passages. So when we pack the nose, there's the collection of that fluid that comes out as oozing. But that is colored with the red, so many people think that is bleeding, but normally it is not there. So the bleeding case is also a very rare thing. Then once in the open thing, when we cut over here, there can be slight numbness or a persistent pain for a few weeks. But that is again acceptable and not a very problematic thing. And then there can be scarring. Like I already explained, we have to give a good counseling to tell the patient, according to his body healing types, or his the skin type, or the amount of space we have to work, the result will come according to that way. So the scarring can be occur, and in very rare cases, we might have to do a revision rhinoplasties. But maybe because some other person has done, he might have done a little less work comparatively what is needed. So those things are there. Everybody does according to his own abilities. So I think that's it about it. Thank you very much. Any questions?
Yes, sir. Good afternoon, sir. We have some questions.
Yeah.
Will rhinoplasty completely solve the breathing problem?
See, this is one question everybody asks me, even while doing a simple septoplasty or FES also. Then I explain all my patients. Like if you have a problem, say about 100 times, that will reduce to about 15 to 20 times, which is in the normal limits. Because this nose is one part which is exposed to everything. The temperature changes, the pollution changes, you can the smells, the anything like the type of food you have, all the things. So we explain all our patients, then don't expect that you will never have a nose blockage, or you will never have a never sneeze, or you never there will be never a running nose. So because allergy factors, everything is exposed on this area. But yes, if something is going down from 100 to 15, 20, we think we are doing our job. So that is, so there are no guarantee like there will be never, you will never have a nose blockage or you never sneeze. So those things have to be explained, because once we do operation, people think that now nothing should happen with my nose, but this is not the case. This has to be explained absolutely clearly.
So, next is how much pain I can expect after surgery?
Minimal pain.
Minimum pain. Okay.
Minimal, minimal.
Can rhinoplasty for functional nose defect improve my snoring?
Snoring, yes, because snoring is normally caused by the obstruction. So any obstruction, like I told you, septorhinoplasty, once we correct the things of the septum, which is causing an obstruction, so obviously these things will improve. Like if we just say, just blow through a big hole or blow through a small hole, so you can see once there's obstruction, there will be some snoring. Once the obstruction is removed, the snoring will definitely improve. But there's no guarantee that it will go totally 100% will be off.
So will I have difficulty breathing through nose during the after the recovery or the
See, for next 48 hours you will have, and then again for a few 1 or 2 weeks you will have some because first 48 hours the nose is packed. Obviously, you have to breathe through the mouth, and once you're breathing through the mouth, you will have dryness and all the things. But then after for 1 or 2 weeks, there will be some edema and swelling in the nose, which will subside gradually. So you will feel like you have a slight cough and cold. And anything else you want to know, you can tell me.
no? Thank you so much, sir. Thank you.
Thank you very much for your patient listening. And any queries or anything you have, then you have the under given numbers are there, and you can contact the Post Spectra, Karol Bagh, for any appointments or anything like that. Thank you very much.